Sunscreen, coffee cups, airplane banner ads, and yes, even porta potties at concerts. That's where your tax dollars are reportedly going to help promote the president's health care law. To Town Hall's Katie Pavlich. Katie, this whole A block is about Obamacare, and it just gets, we've ratcheted it up, the outrageousness, each one. Now we're spending all this money for what? What are we spending our money at?
Well, as if Obamacare couldn't get any crappier, we're now hearing that they're going to try and buy advertising on porta potties at concerts with young people. So what this means is that states are actually panicking now, the states that have agreed to implement Obamacare, because they need young people to get on to the Obamacare rolls. So what are they doing? They're targeting what young people like: the beach, flying banners over the beach. They like coffee. Young people love coffee. They're going to try and get some custom coffee cups advertising for Obamacare. They're targeting concerts with these porta potties. But I don't know about you, when I'm at a concert listening to my favorite band, I'm not really interested in health care, especially when it comes to an unpopular bill like Obamacare.
That's right, Katie. When you're at that Justin Bieber concert, I'm sure you don't want to see that Obamacare ad going across on the banner ad on the airplane. No, but we do need younger people. It's people, I guess you can call them children, even if they're up to 26 years old. They can stay in their parents' health care system. But you do need people 18 to 35 or so signing up, because they put more into the system than they take out. Otherwise, the thing collapses, right?
Right, but I don't think that a couple advertisements inside porta potties or at concerts or at the beach are really going to help get young people onto the Obamacare system, because they aren't explaining why Obamacare is good for them. They're not explaining the benefits for paying more than $100 a month for your premiums through Obamacare. And so I think this is a waste of money, and I don't think it's going to get more young people onto the rolls. Not to mention, lots of uninsured people who don't have health care now actually don't know that Obamacare is becoming available to them, which shows that they're actually not that interested in getting health care at this point, because that's not something they're prioritizing in terms of their budget. So once again, Obamacare is wasting money to implement a bill that's costing more than it's already taken out.
So let's say you're, I don't know, 22 years old, you're in good health, and it costs more to sign up for Obamacare than the fine is. What are you going to do?
Probably you're going to pay the fine, especially when it comes to premiums continuing to rise, especially for that younger demographic, which means in the end, Obamacare is going nowhere, because it does depend on those young and healthy people to foot the high medical bills of people over the age of 35.
All right, we got to go in a second, but the other part of this is, it becomes a fine, but the IRS is administering the fine, and they can't garnish your wages. They can't make you pay. They can just say, hey, at some point you're going to have to pay us. I mean, you're 18, 20, 22 years old. I don't know. I think that's the option a lot of them are going to take.
Right. I think young people have a lot of concerns when it comes to finances, and healthcare, as we've seen, isn't a priority for them, or they would be buying it through the private sector.
Hey, Katie, good to see you.
Talk to you soon.
Very soon.